great concern today to look for eye contact, and you have to look at kids very carefully. What would you say that would be normal eye contact in a child around 3, 4, 5 months that you would look for?
4 months of age is a very critical age for interaction, because the baby starts to make sounds, he starts to interact with the caretakers, with the environment, he makes eye contact. As a matter of fact, babies do start making eye contact immediately after birth. They do respond to what constitutes a gestalt or a face immediately after birth, but because they're very nearsighted, they will do that for very close contact. So the mother, for instance, mother's face has to be about up to 2 feet close to the baby's face for him to make eye contact.
It's more, but it's more than eye contact, looking to make contact,
yes,
not just looking.
Mm-hmm.
And I've seen video where someone said my kid was perfectly okay and had some problems later in life, whatever the reason. You look at the video, the kid wasn't looking for the mother, was just looking. And that's the big differential, you say?
Yeah, well, that's part of what we have mentioned before. That's part of the bonding. The baby is starting to look for the mother. He's starting to turn towards the sounds that he recognizes. If the mother walks into the room, he starts to turn towards the sounds, and he starts to actually search for the mother and the caretaker, who he starts to recognize. And that is a very key element, that the infant is starting to look for the contact. And this is the time he starts to make sounds. And he looks for the response of the caretaker and the mother. So if you do have an interruption or you have an aberration of that, that may be a source for concern.
So it's not just looking for response.
Yes.
Smiling, socially, looking for a response, showing he's reaching or she out to the people around him. Is that correct?
Absolutely.
That's the key point, looking and reaching for socialization back.
Absolutely right.